These are my people. I've been collecting people and traumatizing toys for a really long time. Hey! Hi, YouTube. One of the things I'd really love to do at this time is figure out how to screen share from YouTube Live. But I'm pretty sure that people have explained that it's a really lovely, intuitive, another platform I have to know how to function. Get out of here. Get out of here. Okay, so before I share my screen, Motion. Oh, bye, Motion. I'm going to share my screen on YouTube Live. Yay! Get out. Okay, we'll let you do it, Google, this time only. It just worked. I was so freaking happy. Okay, welcome to examine the Ohio LISW licensing process. Now, let me share with you that the only reason that I knew how to do this, or the reason I even went to grad school, is because my coworkers told me what to do. I was getting ready to graduate and someone walked over from another cubicle and said, "Let me show you my binder of how I've done this." And I was like, "Oh, we don't just have it. We don't just apply." And she said, No, girl. And showed me her logs and her rules. And she explained this to me, which is not intuitive and is very restricting. Why aren't you getting bigger? Redirecting websites. All right, all the steps for an LISW. View. Bigger. Let's make it so big. All right, all the steps for the LISW. Now, the regulating body for the LISW exam and the LSW exam is the counselor, social worker, and marriage and you have to complete a degree from an accredited program. That's the first thing. Here's what you need to know about being licensed. You need to pay the state your money. If you do not pay the state your money, you will lose your license and you can never gain it back. There are many, many, many things you can do as a social worker and end up under supervision with a slap on the wrist and no fine. You cannot not pay your fines. Okay, I'm gonna grab my coffee. Let's stew on that and think about how important it is. Okay, we pay the board. They're so important, we pay the board. Now that that's done, you're going to register and create an ID and password because everything requires more passwords. Now, the nice thing is this e-license site, God willing, we're just going to keep sharing this tab because I think it's not changing tabs on my YouTube share. There we go. So we have for the LSW. And when we click CSW MFT license instructions, it takes us to this website. How do you know it's really a real website that you're supposed to be on? It's going to have a .gov. Okay? The .gov means that this is not, if it's .gov.com, it's a lie. Don't click on it. But when you click on your e-license site, it will take you to another page. And you do have to do this. Now, this is how you verify a license. This is how you file a complaint. Social workers can't go by different names. We can't go by maiden names. We can't change our name and not tell people, just like dentists and doctors. Ooh. Because people have to be able to complain when you do things. Okay? Do you want to verify a license? This is something you have to do to get when you work on any of these boards. So this is the e-license system, not just for social workers. It is Ohio Professional Licensure altogether. We'll look it up. So if I wanted to look myself up and see if I have a valid license, I would type in, I have a very findable name. I mean, I'm not the only one in the world, but If I'm in Ohio and I search, you see the licenses I have had. I had my LSW, I have my I, and I also have the S so that I can supervise people. So technically I hold 2 at this time that are currently active, and you can see right here, closed. Are there any board actions? If there was, it would be here. And so this is a screen that you can print, and at the date and time, it tells you if your license is valid or not. So this is something that has to be on file. For example, if you're like me and you're going to be opening your own therapy practice, I would have to print this one. It also will tell you when your license expires, so you can see when you need your continuing ed, because you do need 30 hours every other year. Mine is expiring to 7/27, so I have about a year to get my 30 hours, including supervision specific hours, 3 ethics hours, and anything else as you see fit. Now, what if I want a new search? I'm going to show you my friend who I have written professional employment references for and had to look up his name in here, and I cannot ever find him. I have to look him up by number. Now, this is my license number, and I have to write it sometimes. Like if I'm writing a return to work note or an excuse note or an accommodations note, if I'm signing off on someone's 504 or IEP plan or intellectual disability with some kind of a board. So most people have memorized this, because if you, for example, help people qualify for disability bus passes, you're probably writing this number out 5 times a day. So when people ask me to do things for them with the board, I ask them what your number is so that I can put it in here, because when I look up George Smith in Ohio, there's 3 of them. Abandoned status. Oh my goodness, there's some deceased people on here. You don't have privacy even in death if you have a license, and that is fine. So I don't know which one this is, because there's more than one. I think this is my guy, because I know he has an S. I just can't imagine that he's had it this long, though. Yeah, so I have to make my friends who want their exam professional statement to give me these items. So every single person who I do 1 hour of supervision work for, I need to know, what is your job title? When did I start seeing you? When did I stop seeing you? Because I don't know what year my friend George got his. I know what year it is now, because I would have him email me these. What are the number of hours you completed? So if you worked 40 hours a week and I supervised you once that month, then you worked 40 times 4 is 160 hours, and I gave you 1 hour of supervision. Well, you can get a whole lot more. So you are going to have 150 hours total, and you are going to have of supervision, and you're going to have 4,000 hours total of work. So it's a math problem. And as long as we're not trying to take credit for more than 2,000 hours of work in a year, which is a full-time job per union standards. So you cannot, for example, say, Patti supervised me 150 hours and I worked 4,000 hours in 18 months. You have to have it last over the course of 2 years. They are not going to check this. They're not going to check this. So why is this? Don't worry about it. People get very stressed about this. You're just going to write individual and group supervision hours, and you will be keeping track of that, right? But I also ask people, please give me your license number. All right. We have to register and create a user ID with the e-license system, which is in here. You have to complete the application online, which says, like, are you going to be a licensed social worker? Did you take a test? Did you go to an accredited program? These are all yeses. You either have a diploma, or right now, after spring break, you are getting a letter of good standing from your school, and your school writes these every semester, so they will know exactly what to write for you. This is the same letter that they give you when you are enlisting for an SWT during graduate school. They email you within 48 hours or 6 weeks. Truly, there's no rhyme or reason. I have people who apply in the same state to the same person, and it just takes a really long time. Then you have to take the LSW exam, which we call the social worker pass fail. The laws and rule video, you cannot fail this. There's a video. Ohio Revised Code 4757 is all the things in the state of Ohio that make us a social worker. These are the things that they are testing you on. Are you licensed as a marriage and family therapist? No, I am not. Are you going to renew your license? Yes. Can a social worker do this? Can a social worker work there? One of the best ways that you have to sign in and have watched the laws and rules video. Let's see, it's pretty quick. It's 9 minutes and 8 seconds long. This is not like a scary one. This is one where I think this is the one, or it might be the one after you already passed the test, where it's like 15 questions, and if you get them wrong, you just have to keep answering. Like, you just have to keep selecting them, and you can't exit. An FBI or BCI background check is something that you have to pay for, and they'll be like, oh, just find someplace. There's a link, how to find someplace. I'm going to search by zip code 43713. Where can I go? I can go to the school on West Church Street, or the police department on North Arch Street. They're very, very close to each other, and I can make an appointment and I just call the number. I can make an appointment and I call the number. These people want your $65. I promise. It's very easy. You just go in for the fingerprinting. It's the same place you have to get one if you are going to volunteer with the Catholic Church for the virtues. It's the same thing, the same check that I had to do when I was volunteering at a therapeutic writing program. The official transcript showing your conferred degree is something you have to purchase from your university, and they will mail it for you in a sealed envelope. There is an exam guide from the Association of Social Work Boards. You don't have to pay for this. This is free. The basics, the construction, the steps. Candidate Service Center, how do you schedule your exam? Everything with the ASWB, they regulate the exam. Council on Social Work Education says what is a program. ASWB is what is the test. 2 kinds of questions. There is a phone number here in our slides. The 2 kinds of questions, these are the 2 things that my students write on their dry erase boards when they walk in, is aspirins and about Aladdin's apples. Okay? There are two, we're going to go through a couple practice questions here. What is the best thing that you can do? On the ASWB, they have direct questions. What drug is an antidepressant? What drug is a depressant? There's an answer, there's a question, it's information. There's also vignettes. What should you do first? First, you think of Aladdin, Farmer Aladdin. The first thing you do is remember that Farmer Aladdin raises expensive apples from India. Farmer Aladdin raises expensive apples from India. F is for feelings, A is assess, R is refer, educate, advocate, intervene. If I show up to this situation, whatever it is, what should I do first and begin family counseling? I already know it's the wrong thing because the last thing I do is intervene. The first thing I do is feelings, right? Refer? No. It's not possible to do feelings first because it's not an option. I know it's not going to be beginning family counseling. I know it's not going to be referring because Farmer Aladdin says first we talk about feelings. Then we assessed. Farmer Aladdin, assess. And look at that. It's our second app. Assess is the word that's there. This is not about being a good social worker. This is about gatekeeping and mentorship. I have students tell me all the time, I wrote these two things on the board. When I didn't know what to do, I just flagged it. And then I went back and said, is it first or best? Look at this. What's the best thing? What's the very first thing you do is feelings and then assess. What's the best thing? Assess is number one. It's one of our social work competencies for a reason. What's the best example? Is there, and someone's not going to be able to come. Is there an assess option? A social worker at a substance use treatment center meets with an adolescent client who expresses remorse about engaging in sexual activity while drunk. I hear feelings, remorse. Okay. The social worker tells the client, this is psychoeducation, that the sexual promiscuity while intoxicated may indicate an alcohol use disorder. Well, here's the problem I have with the exam. Don't let it distract you. We're staying calm and I'm not worried about this. Okay. Victim blaming. What does best describes the social worker's approach? Ew. Okay. Education. I said psychoeducation, right? Confrontation. I think that's pretty confrontational. Sexual promiscuity. Summarization would be the social worker would say, wow, it sounds like you got some regrets. And that's not what they did. They provided information. Clarification. I'm sorry, did you say that was consensual or not consensual? Let's talk about sexual consent when intoxicated. I would love that sentence. That would be clarifying. No. So education. What should we do first? Or what is the best description? See, that was a trick question. The termination process is most often associated with. This is information. Application. There we go. What should we do first? What should we do next? So this is in your ASWB study guide. Aspirin, assess before acting. Don't we love that? Don't we love when people discuss, ask, clarify, inquire? That's like great humaning. We want to start where the client is. I really hate my kid's mom. I don't start by, all right, someone says, I can't stand my kid's mother, that bitch. I don't say, let's really just talk about our language. That's not starting where they are. That's starting where my discomfort is. Ew. Protecting life. Protect life, ice out. Moving on. Informed consent. The person understands what is happening and why. Rule out medical conditions, influenced intoxication, don't treat if intoxicated. Like, what a great idea. Non-judgmental means that I understand that whatever choice this patient makes is going to impact their life more than it's going to impact my life. So why should I be more upset about what they do? They are making a choice, and I'm helping them be glad they made that choice. All right, supporting self-efficacy. We don't cripple people. Okay, this LSW study guide link has the PDF that people love from WordPress, from iPast. And this has got to be March 18th from many years ago. Look at this. The archive is from 2012. Related 2012. So this has been working for quite some time. Okay, here's question 1. Here's vignette 1. An elderly woman comes to see you with her daughter. The daughter wants to make arrangements for her mother to enter assisted living. You attempt to conduct an interview with the elderly woman about the move, but she only wants to talk about things that happened years ago. Your best response is what? All right, the first thing I'm going to encourage you to do is identify the patient, because you've got 2 people coming in here. And if you're a social worker, you might be a woman, and you might identify with the woman bringing the elderly woman in. And you might have a lot of feelings about housing because you are a social worker in America. Your best response, what's the best thing we can do, is not what we want. We want to assess before acting and start where the client is. We think we're protecting life. We're not. This woman is not at a point where we need to worry about taking away her civil rights and saying, that's nice, honey. We're not talking about then, we're talking about now. Tell them you cannot help her. Starting where she's at, I feel like is B, encouraging her to talk about the past experience. Look at this. Have her committed to an inpatient program. That's an action. That's a no. Try to change the subject. This is what we do to people all the time. But really, encourage her. Yeah, we start. The patient only wanted to talk about what happened years ago. It sounds like that's where we need to work through, don't you think? You are in a counseling session. Oh, look at this. It's like I've done this before. Best is aspirins. And first, farmer Aladdin raises expensive apples from India. You're in a counseling session with a struggling couple. They argue through the whole session, and you attempt to help them set some goals for improving their relationship. Any of my couples who happen to be watching, first of all, why are you watching me at 7 o'clock in the morning? Second of all, this sounds like couples therapy to me. All right, you attempt to help them set some goals for improving their relationship. Barf. In face of all the arguing, what is the best way? A, ask them to leave if they can't discuss things amicably. I have safety rules we have, which we're not going to go over. My couples know. Patti doesn't play. We can argue. There's some things we're not going to do, though. We don't name call. We don't threaten. Set a goal for improving communication between them in emotional situations. I feel like that is the goal of couples therapy, so I feel like that's a trick one. C, ask them to reach a compromise on the specific items they are arguing about. That is not in best or first. Okay. Best is aspirin, so we're trying to assess. Asking them to reach a compromise is not assessing. That is falling into the trap of we have to agree on what we think so that we can feel. This is actually from couples therapy. We have to agree on the entire trauma narrative before we can start the psychoeducation. This is the order of gradual exposure therapy, and this is why it's like on my board all the time. Hey, Jujitsu cousin. We ask them to reach a compromise. No, we're not. We're not compromising on what we think. We're not compromising on behavior. That's not the goal of couples counseling. Decide who's right. Just suggest they have individual sessions rather than joint meeting. In a dyadic, such as children under the age of 5 are dyadic interventions where you're intervening with the child and at least one caregiver jointly in a way you would not interact with either one of them individually because you're working on the communication. Same thing. It's not going to be D. In couples counseling, they're not there for individual goals. They're there because the communication between them, they need a translator. So how do we set up our translation software when we are emotionally flooded? This is the goal of couples therapy. If that's something you like practicing, you should be a couples therapist. All right. Client walks in to the agency office. I see first, what am I looking at? Am I going first or best? Farmer Aladdin. So I'm thinking feelings and I'm thinking assessing, options for feelings and assessing. Do you see how helpful this is to write down your whiteboard? So if you walk in to your exam, you can't bring anything with you, but you do get a whiteboard and you can just write down this right here. You're going to think aspirins and Farmer Aladdin, and you're going to say, okay, feel and assess. I'm going to look because it says first, as I'm reading through the question, a client walks in to the agency office in a hostile and aggressive mood. There's a feeling right away. He begins to verbally threaten the staff. We're thinking protect life. Verbal threats don't end lives, so I'm going to ignore that one. What is the first thing you should do? Call 911. Trick. No. Calling 911 is to engage someone to open an airway, right? Or to engage someone to stop bleeding, or to get someone to negotiate a hostage situation. And if you're a licensed independent social worker, that's you, babe. So you don't get to put that as an example. Calling 911 or alerting a supervisor many times is not going to be the answer. B, attempt to change the subject. Try it. Let me know how it works. I don't think that that's reflecting feelings personally. Acknowledge that the client is feeling hostile and angry. Doesn't that seem like the first word, feeling? It seems like it. Encourage the client to discuss how he feels. I feel like that one is going to require a little bit more neocortical engagement than we have when you walk in hostile and aggressive. So defensive patients, I set limits. I can set limits, or I can say, wow, you are ready. You are ready to get this done. You know what I call? I call that future oriented. I'm not concerned about you. You got plans tomorrow. If you don't get this done today, you're going to get it done tomorrow. Wow. I love a man with a plan. He has a plan. He's going to threaten us. Great. Tell us more. Oh, sorry. I was just kidding. You don't want to tell us more? Okay. But you are upset. What's going on? That is a social work intervention. That is a front desk intervention that I train lots of licensed and unlicensed people on. Acknowledge they're feeling hostile. We don't pretend. Can you imagine if I walked into the office and I told my coworker, I think my husband's trying to kill me. I think he's been putting something in my oatmeal and I don't feel well. And they were like, anyway, the coffee maker's fixed. That's absolutely crazy making when people change the subject because they're uncomfortable. And that is not communicating to your patient that you're a social worker. It's communicating to them that you're their mother-in-law. All right. Who is Aspen? There's a part of research design that Aspen is left out. Get out. Informed consent. I love that one because I'll tell you why. Influenced intoxication, informed consent is right on here under aspirins. Okay, research design. Aspen is working on designing a research project that measures the effect of poverty on school performance of children. Oh, doesn't that sound like a good one? Public determinants of health. She has reviewed previous literature on the subject, demonstrated the need for the research. So she's done a lit review, demonstrated the need, and has described what she needs to test her ideas and the methods. Furthermore, she knows how to test whether or not her results are valid. So first, aspirin's best. This one's first. Feelings, assess, refer. We don't know how we're talking to these children. How do they know they're being? It has nothing to do with data. She's not specific. She's specific about her hypothesis. She's justified the research. So yeah, there's nothing in here about the patients, how they feel, or that they understand what's happening, or that they want it. After the exam, you have to, nothing's there, 404, not found. We're going to have to update it. After the exam, you have to track your supervision yourself. 404, page not found. All right, we're going to look for a Vegas bathtub. We're going to look for, I have a PDF. All right. We're going to look on the LSW website. I'm just frustrated because I know I've made a copy within the last 24 hours of a PDF. Oh, you know where it is? Literally. Did I put it on my website? That would be great. No cash payments. Okay, I have my cash rates up, but I do not have my supervision thing up. We're going to have it posted. Dang it. So you have to keep track of your license number. I can't open it without doing a HIPAA or FERPA violation right now. So we'll have to do it on the recording later. Let's go. Sample supervision log Ohio social work. They're not hard to find. See, as a supervisee, this is why you have to keep track of your license number, and your supervisor's license number. Go on every form. Date, time, you do 1 or 2 hours at a time, individual or group. The goal, so if you're doing 2 hours of supervision, that could cover the last week. It could cover the last 2 weeks. It could cover the last month. There is no rule that says it has to be every week or every other week. It just has to be spread out. The goals of the supervision to build skills and introspection in performance of social work competency. Sorry, my magic keyboard died, so we're struggling here. You could have that sentence on every single one. The content of supervision for group, MP reviewed case at inpatient location, like inpatient service location, considering early termination. Review and workshop rationale. Have you ever seen a case like that take 2 hours? Absolutely. Sometimes every person, if I have 4 people in this group, I want something from Michael, I want a case from TD, and I want a case from Patti, right? You should be keeping track of this as a clinician. So generally I will have in group supervision on Saturdays, one person takes notes, and then we just email to the whole crew, and everyone puts in their name and license number. We have to review supervisor's note. Great work. Maybe I list a resource. I like doing that because you have to keep track of it anyway. So why not have resources, PDFs, SAMHSA and CTSN, places I like to go for free information. And then every quarter, you need to have these signed by me. So we'll like meet up for coffee. So people print these out. People print the PDFs and email them to me. But you keep track of them. The supervisor does not. You cannot get more than 75 training supervision hours a year. There are 52 weeks in a year. You should be scheduling more than 1 training supervision hour per week. Your date of graduation will be 1 week after your graduation ceremony, and 2 years from that is the soonest date you can say I have 4,000 hours of work. You will just cut and paste these items into an email because your supervisor has to know how to answer those questions, which are mostly yes or no's, but have some dates as well. So we've got some groups coming up at East 40th this fall. We've got some seeking safety groups for adults and teens coming up in Asiatown. I'm recruiting right now interns, and in the fall, I will co-facilitate larger 10-week sessions for teens and adults and caregivers. But we're starting this summer with some pilots that's going to be just me. In the meantime, I do have 2 staff working for me. George Smith and Peter Century are accepting new patients today for Telehealth Online. And I am really manifesting that I'm going to have an intern who will want to do after-school programs because so many people are having social emotional learning cut and counseling cut and services cut from their elementary schools. So we are going to be doing a cash model, and we're going to try to get some grants to fund after-school therapy. We're also going for our CMS certification, which should be live by April 1st. So if you've joined me today, I want to thank you. You can always follow me at wellnesscleveland.vip, Patti Napolitano, social worker, and we will be having more exam prep and question practice to come. I really hope that screen share.